Introduction. ADHD is believed to stem from issues with chemical neurotransmitters in the brain, specifically dopamine and norepinephrine. It is commonly observed that ADHD can be congenital and hereditary. It is common for symptoms to remain latent for several years. In younger children, hyperactivity is often considered a hallmark sign. It is common for individuals with ADHD to receive a diagnosis later in life, often when the challenges of daily life become unmanageable or when symptoms become particularly burdensome. ADHD symptoms can also change and develop as time goes on. It is common for behaviors such as fidgeting in childhood to manifest as restlessness, poor planning, and forgetfulness in adulthood. Unlike males, females diagnosed with ADHD exhibit lower levels of impulsivity and higher levels of distractibility in comparison to their male counterparts. Throughout this book, I will be sharing several ideas and strategies with you on how to help your teen manage and thrive with ADHD. Chapter 1. How ADHD is diagnosed. Despite the advancements in medical diagnostics, ADHD is still diagnosed based on the observation of a specific set of behaviors or symptoms that have a significant impact on an individual's daily functioning over a prolonged period of time. Although brain scans have revealed irregularities in specific regions of the brain in various research studies, it is important to note that these findings only indicate differences between groups and cannot be utilized to diagnose ADHD in individual cases at present. Various neurological, psychological, and educational assessments have been employed in the past to enhance the impartiality of an ADHD diagnosis, but regrettably, they have not yielded favorable outcomes. It has been discovered that poor performance on vigilance testing, which was previously believed to indicate inattention and impulsivity in individuals with ADHD, is not a reliable method for diagnosing ADHD. It is worth noting that researchers have made efforts to examine and categorize EEG brain wave patterns in individuals with ADHD. The objective is to identify certain ratios that may be unique to this population. Although there have been some positive results, this particular diagnostic tool has not yet been widely utilized. Only trained medical or mental health professionals are qualified to diagnose ADHD. This is done through a thorough process that includes structured interviews, symptom rating scales, and other diagnostic tools. In order to make a proper diagnosis of ADHD, it is essential to meet the diagnostic criteria set forth by the American Psychiatric Association, APA, and shown in the DSM-4TR. The diagnostic criteria for ADHD require the presence of at least 6 out of 9 symptoms of inattention or hyperactivity/impulsivity, which must have been persistent for a minimum of 6 months. Additionally, some of these symptoms should have been present before the age of 7, and meeting these criteria is necessary for a diagnosis to be made. It is also essential to note that the individual's social, academic, or vocational performance must be considerably impaired, and the indications must manifest in at least 2 distinct settings, such as workplace, school, or the home environment. ADHD among male and females. Research suggests that attention deficit hyperactivity disorder may affect approximately 4.4% of adults and 8.7% of children aged 8 to 15. It is worth noting that meeting the diagnostic criteria does not necessarily guarantee a diagnosis, and it has been observed that females are comparatively less likely to receive a diagnosis than males. It is interesting to note that there was a time when ADHD was diagnosed in males at a significantly higher rate than in females, with a ratio of 10 to 1. However, this ratio has since decreased and is now closer to 2.5 to 1. Research suggests that the gender gap in ADHD diagnosis observed in children may diminish with age, as indicated by one study examining the gender distribution of individuals with the disorder. Although there is a dearth of definitive statistics regarding the prevalence of ADHD among women and the male-to-female ratio of adults with the condition, it is widely acknowledged that a significantly greater number of adult women are affected by ADHD than was previously recognized. At various clinics, the number of female patients with ADHD has increased to the point where they are equal to or greater than the number of male patients. It is interesting to note that both males and females are diagnosed with ADHD at similar rates during adulthood. This could be due to the fact that women are not required to obtain referrals in order to receive treatment for this condition. It is observed that females with ADHD are being evaluated less frequently than their male counterparts. This could be attributed to their tendency to depend more on others, particularly their parents and teachers, to initiate the evaluation process. Chapter 2. ADHD Symptoms. It is important to note that ADHD can present differently in each individual, regardless of gender. However, some common symptoms in individuals with ADHD may include difficulty with organization, forgetfulness, impulsivity, and trouble with time management. Based on the DSM-4 criteria, the primary symptoms of ADHD, which include inattention, impulsivity, and hyperactivity, are consistent across genders. It has been observed that females tend to report comparatively lesser symptoms than males while utilizing the DSM-4. However, it is noteworthy that despite reporting fewer symptoms, females experience an equivalent degree of impairment. It has been previously established that females with ADHD have a tendency to internalize their symptoms. Females with ADHD often describe experiencing emotional dysregulation, which refers to difficulties in managing their emotions. This can lead to a sense of being on an emotional roller coaster. Research suggests that there are varying levels of ADHD symptoms reported by men and women. It is common for women to report experiencing dysphoria, inattention, challenges with organization, and impulsive behaviors as their primary symptoms of ADHD. Based on the research findings, it appears that the observed dysphoria is more closely related to a responsive moodiness rather than a manifestation of clinical depression. In contrast, males tended to express concerns regarding their behavior, ability to learn, capacity to handle stress, level of focus, and aptitude for social interaction. It is noteworthy that self-ratings reveal remarkable gender disparities, where women tend to express lower self-esteem, fewer resources, and more challenges in contrast to men. Prevalence of ADHD in females. It is common for girls with ADHD to experience difficulties with maintaining focus rather than exhibiting disruptive behavior. Research suggests that in comparison to boys with ADHD, girls with ADHD tend to display less disruptive behavior. In the case of women, a deficiency in concentration can present itself as daydreaming, confusion, difficulty in processing information, and inability to follow instructions. It is important to note that even if a female exhibits hyperactive behavior, it may not necessarily resemble the behavior of a male in a similar circumstance. It's possible that unlike boys, a young girl's ADHD symptoms could manifest in a variety of other behaviors. It is possible that the individual may exhibit avoidance behaviors, such as physical complaints or a genuine fear of attending school due to negative experiences in the classroom. These behaviors may stem from low self-esteem and difficulties with academic performance. It's possible that she could experience discomfort in the classroom setting, leading her to withdraw from participating in activities such as group work and answering questions. It has been observed that female adolescents with ADHD tend to experience more psychological distress compared to their male counterparts with ADHD. According to a research, females diagnosed with ADHD may be more prone to feelings of worry, discomfort, depression, and a sense of lacking control over their own life. It is possible that the presence of these symptoms could result in an incorrect diagnosis of depression in women with ADHD, potentially resulting in the condition going untreated. Females tend to receive a diagnosis of ADHD inattentive subtype more frequently. This is attributed to the fact that they tend to display fewer hyperactive/impulsive symptoms and more inattentive symptoms. According to recent clinical studies, it has been observed that females with ADHD tend to have a unique appearance compared to their non-ADHD counterparts. The inattentive subtype of ADHD is more commonly found in females. It is noteworthy that despite the extensive research indicating that girls are also susceptible to ADHD and are more prone to display the inattentive subtype, this aspect has not received the attention it merits. It appears that researchers have initiated an exploration into the factors contributing to the underdiagnosis of ADHD in females, and some insights have been gained. The current diagnostic process for ADHD places a significant focus on externalizing symptoms, such as hyperactivity and impulsivity, as indicated by standardized rating measures completed by both teachers and parents. The research suggests that mothers tend to believe that the items from a commonly used ADHD questionnaire are more applicable to males than females. There may be a discrepancy between how parents and teachers perceive girls who exhibit ADHD-like behaviors. Parents may be comparing their daughters to other girls, while teachers may be comparing them to male classmates with ADHD. This could potentially lead to some girls being overlooked by their teachers despite exhibiting symptoms of ADHD. It has been observed that female students with ADHD may exhibit subtler symptoms as compared to their male counterparts, which may sometimes go unnoticed by teachers. A study conducted in 2009 examined the possibility of disruptiveness being a contributing factor to the gender disparity in female with ADHD. The results of the study were comparable to previous findings. Based on these findings, female students with ADHD were referred by instructors less frequently than their male counterparts with ADHD or female students with both ADHD and oppositional defiant disorder. Another findings, a nationwide study conducted in 2004, which involved 1,797 individuals from the general public, 541 parents of children with ADHD, 550 teachers, and 346 children aged 12 to 17 with ADHD, may shed some light on the disparities in referrals for females with ADHD. It appears that there is a prevailing belief among both the general public and instructors that ADHD is more prevalent among male students. People hold the belief that boys may exhibit more externalizing behaviors, whereas girls may experience internalizing symptoms such as lack of concentration and feelings of sadness. A significant number of educators struggle with identifying symptoms of ADHD in female students, with 40% reporting difficulty in doing so. Additionally, a majority of educators, 85%, seem to believe that female students are at a higher risk of not receiving appropriate treatment for ADHD. To effectively address the issue of underdiagnosis of girls and women, it is crucial to acknowledge the significant lack of information and referral bias that parents and teachers exhibit. The matter of underdiagnosis of ADHD in females necessitates the implementation of various strategies. It is important for healthcare professionals to consider that the presentation of the disorder may vary based on the patient's gender and age. In order to ensure a thorough and accurate diagnosis, it is imperative that healthcare professionals have access to the most current and comprehensive criteria and standards. While significant strides have been made in recent years, there remains a considerable amount of work to be done in comprehending the nuances of ADHD symptomatology as it pertains to gender differences. It is important to take a comprehensive approach when diagnosing ADHD, especially when working with female patients. It is important for parents, schools, and doctors to be aware of the developmental changes in ADHD symptoms that occur with age. It is common for hyperactivity to decrease as children grow older, while inattentiveness tends to remain consistent over time. A study conducted some time ago focused on adolescent females with attention deficit hyperactivity disorder. The study aimed to investigate the long-term effects of the disorder. In the study conducted, a significant number of girls who were diagnosed with combined subtype during childhood were found to meet criteria for the inattentive subtype, or no longer met criteria for ADHD at follow-up. Although there have been significant improvements in diagnosis, it is important to acknowledge that girls continue to experience symptoms and face various challenges throughout their lifespan. It appears that the individual did not exhibit enough symptoms to meet the diagnostic criteria as defined at present. It is possible that women may exhibit a persistent pattern of inattention that becomes more pronounced as they age. It is possible that the alteration in symptoms could result in an overlooked diagnosis of ADHD among these women, as identifying inattention can be more challenging than identifying hyperactivity. As women progress into adulthood, the increasing societal demands may lead to a greater manifestation of ADHD symptoms, specifically those that affect executive functioning, such as organizational and time management skills. In order to make a precise diagnosis in women, it is necessary to redirect attention from childhood behavioral problems, such as hyperactivity and oppositional behaviors, to symptoms that indicate executive functioning difficulties in organization and problem solving, which are commonly reported by older teens and adults with ADHD. It is not uncommon for women with ADHD to experience feelings of being overwhelmed by the demands of daily life. They may express frustration when comparing themselves to other women who seem to handle similar responsibilities with greater ease. It is common for women to devote significant amounts of time to balancing their professional and domestic responsibilities, often without recognizing that their difficulties may stem from an underlying condition that can be effectively managed and addressed with proper diagnosis. Chapter 3. What risks do girls with ADHD face as adolescents? Only 16% of females who are diagnosed with ADHD as children do well as teenagers. Over the years, it has been noted that these females are more likely to engage in sexually risky behaviors, drug abuse, cigarette smoking, and eating disorders. As an example, teachers have discovered that girls with ADHD are more prone to act promiscuously. Also, girls with the inattentive form of ADHD were shown to be less likely to demonstrate a favorable adjustment at follow-up compared to girls with a mixed form of ADHD. Because of their ADHD symptoms and negative experiences, all females with ADHD are more likely to make poor decisions and have weak problem-solving skills. They often place the responsibility for their failure in both academics and interpersonal interactions on themselves when questioned about it. As a kind of self-treatment, these young ladies could experiment with food, drink, or narcotics. Does ADHD have an impact on how people feel about themselves? People with ADHD, especially girls and women, often think they are untalented and that nothing will ever change for the better. A girl with ADHD is likely to experience a decline in self-esteem when she attempts to maintain social appearances at home and in the school, and is met with adult criticism on both occasions. A girl with ADHD sees other females and immediately realizes that she is different from them. This stereotype for girls with mixed subtype ADHD is significantly reinforced by society's disapproval of hyperactive, messy, disorganized, or usually tomboy behaviors. Studies have supported these negative ideas of oneself, and it has been shown that women with ADHD have a more negative self-image than men with ADHD. A female with ADHD has probably had a negative view of herself for the majority of her life, whether it was due to her mother's disapproval and her teacher's judgment when she was a young child, or society's censure of her impulsive, risk-taking behaviors when she was a teenager. Instead of the cognitive difficulties of ADHD, the majority of the psychological harm and mental health problems reported in women with ADHD are likely the consequence of these deeply ingrained negative emotions and self-criticism. Early detection of ADHD is essential to avoiding poor self-esteem in girls and women, and is necessary if they are ever to be free of self-blame and the belief that everything is their fault. These women tend to think of themselves as imperfect and unintelligent when they lack a diagnosis to explain their struggles in school and as children. Is ADHD inheritable? ADHD is a hereditary disorder with deep origins. Between 60% and 80% of ADHD cases are thought to have a familial origin. A broad range of risk factors, including but not limited to preterm, low birth weight, exposure to cigarette smoke during pregnancy, poor nutrition, and diseases including meningitis and encephalitis, may cause learning and attention problems in young children. When compared to the general population, it has been discovered that a number of gene variants are overrepresented in the ADHD population. Several of these genes are known to play a significant role in behavior and cognition. ADHD has been associated with a deficiency in these genes or an overabundance of repetitive DNA sequences in the areas of the brain that control brain function. Each person has access to thousands of these genes. The symptoms of ADHD are the same for everyone, notwithstanding genetic variations. However, these variations might be to blame for the wide range of symptoms associated with ADHD. There is currently no widely available genetic test for ADHD. Researchers are currently working to identify the specific genetic risk factors for ADHD. To make an ADHD diagnosis until then, a comprehensive clinical interview is performed to examine a patient's past, present, and family history. A family tree may be used to identify people with ADHD in their families, including those who were never given a diagnosis. A family history talk with your doctor may show behaviors characteristic of individuals with ADHD, even in the absence of a formal diagnosis. These behaviors include an unwillingness to commit, dropping out of high school or college, switching jobs often, having difficulties completing tasks, having issues managing one's life, and having several relationships or marriages. Do children with ADHD have co-occurring disorders? How soon comorbid disorders are considered in the context of ADHD becomes an important question. A study of 165 children aged 4 to 6 and 381 children aged 7 to 9 revealed similar rates of impairment in school, social, and overall functioning. ODD diagnoses in females with ADHD occur at a rate that is around half that of boys with ADHD. Researchers have shown that girls are more likely than boys to have anxiety and mood disorders in groups of children in elementary school. Girls with ADHD often experience poor self-esteem and guilt, and many women report feeling ashamed of their symptoms as early as age 8. Girls in primary school with ADHD who do well academically generally have already suffered a great loss of self-worth. Since they have to put in more effort and time to complete basic tasks, it's simple for them to believe, and for others to believe, that they are less intelligent than other children. According to one study, girls who received an ADHD diagnosis as youngsters were more likely to grow up with psychotic mood or anxiety disorders. The incidence of these disorders has increased with time. Among young people, more than 60% report at least one symptom, compared to 25% of the control group, yet the problems often start in childhood. Is it common for people with ADHD to experience mood problems, such as despair and anxiety? It is not uncommon for individuals with ADHD to also experience symptoms of depression. However, the order in which these diagnoses are made can vary depending on the individual's unique presentation and the clinician's assessment. It is important to seek a comprehensive evaluation from a qualified mental health professional to accurately identify and address any mental health concerns. It appears that experiencing demoralization and persistent, mild sadness, also known as dysthymia, is a common occurrence when dealing with ADHD, as research has indicated. It is not uncommon for females with ADHD to also struggle with depression, which can make it challenging to accurately diagnose and treat their ADHD symptoms. It is not uncommon for females with ADHD to receive a diagnosis of depression due to the presence of coexisting or comorbid symptoms. However, it is important to recognize that ADHD is the primary diagnosable condition in these cases. The manifestation of depressive symptoms can potentially hinder, complicate, or postpone the identification of ADHD diagnosis. The presence of untreated ADHD symptoms may continue to cause difficulties for these individuals, despite the potential benefits of antidepressant medication and therapy in addressing their specific coexisting conditions. It is common for adolescent females with ADHD to receive treatment that focuses on addressing symptoms of depression, particularly when those symptoms are prominent. According to a national poll conducted by Harris Interactive in April 2002, there is a significant difference in the percentage of girls, ages 13 to 17, with ADHD who received antidepressant treatment prior to their ADHD diagnosis compared to boys with ADHD. Specifically, 14% of girls reported receiving such treatment, while only 5% of boys reported the same. According to a research, more than half of the young women who were diagnosed with ADHD reported that having a label for their condition was beneficial for them. It is common for individuals with ADHD to experience depressive symptoms as a secondary effect of their condition. However, when ADHD is accurately diagnosed and treated with stimulant medication, these symptoms often subside as they were not the primary issue. It is not uncommon for individuals with ADHD to also experience symptoms of bipolar illness. Additionally, research suggests that women may be more likely to receive a misdiagnosis of bipolar disorder when they are actually experiencing symptoms of ADHD. It can be challenging to differentiate between ADHD and bipolar disorder in female patients due to the shared symptoms of mood swings, increased energy, hypertalkativeness, impulsivity, racing thoughts, irritability, and sleep disturbances. It appears that both conditions have a strong genetic component and can significantly impact the individual's functioning over the course of their life. It's worth noting that ADHD appears to be significantly more common than BMD, with a prevalence that is estimated to be around 10 times higher. It is not uncommon for adults who experienced ADHD during their childhood to exhibit symptoms of both disorders. Research suggests that a small percentage, Approximately 6 to 7% of individuals diagnosed with ADHD may also experience bipolar disorder. Conversely, only about 20% of those with BPD are likely to have ADHD. It is worth noting that a significant proportion of children, specifically 80%, and adolescents, approximately 1/3, who have been diagnosed with BPD also exhibit symptoms of ADHD. It is worth noting that individuals who experience mood swings associated with bipolar disorder at an earlier stage in life may have a higher probability of also having comorbid ADHD. It is important to exercise extreme caution when making a diagnosis to avoid the possibility of a misdiagnosis. It can be helpful to consider the key differences between ADHD and BPD when attempting to arrive at an accurate diagnosis. It's important to consider various factors when assessing mood disorders, such as the age of onset, duration, sleep patterns, stability of mood swings, and whether they are in response to external stimuli. Additionally, family history can provide valuable insight into potential underlying causes. Let us examine each of these criteria separately to aid in differentiating between the two diagnoses. It is common for individuals with ADHD to experience symptoms that persist throughout their lifespan. It is important to note that in order to make a diagnosis, symptoms should manifest by the age of 7, although they may not necessarily affect the individual's daily functioning. While BPD has been observed in children, it commonly manifests during the teenage years or early stages of adulthood. It can be inferred that a possible diagnosis for the aforementioned symptoms presenting before adolescence is ADHD. The symptoms of bipolar mood disorder tend to fluctuate over time, with periods of normal mood in between episodes. On the other hand, the symptoms of attention deficit hyperactivity disorder tend to be more persistent and may manifest earlier in life. Chapter 4. Sleep habits of people with ADHD. It is common for women with ADHD to experience difficulty falling asleep or waking up too early, which can result in inadequate sleep of 7 to 9 hours per night. It is possible that an individual with BPD may not have the same level of need for sleep. It is not uncommon for a woman in a manic state to be able to function effectively with minimal sleep until she reaches a point of psychosis. Females diagnosed with ADHD tend to exhibit heightened emotional reactions to various situations. It is common for one's attitude to be influenced by both positive and negative events that occur in their life. Whether it is achieving a personal goal or experiencing an unexpected setback, these occurrences can have a significant impact on one's emotional state. It is observed that women with bipolar disorder experience mood swings that are often unpredictable and not necessarily linked to external factors. This is in contrast to individuals with ADHD, who tend to have identifiable triggers for their mood changes. It seems that individuals with ADHD may experience mood swings that can fluctuate quite rapidly, potentially within a matter of minutes. These changes in mood may be influenced by external stimuli or events in their surroundings. It is noteworthy that in individuals who experience fluctuations in mood associated with bipolar disorder can persist for extended periods, ranging from days to weeks. Women who experience BMD tend to report having rapid and overwhelming thoughts, while those who have ADHD tend to describe their thoughts as jumping from one topic to another, particularly when attempting to drift off to sleep. It is possible that some medical professionals may mistakenly diagnose a woman with bipolar mood disorder instead of ADHD if she mentions experiencing racing thoughts while trying to fall asleep. It is worth noting that both ADHD and BMD have a genetic component. It is crucial to observe indications of both disorders while examining the family history, especially if there hasn't been any official diagnosis in the past. Anxiety and ADHD. It is common for females with untreated ADHD to experience anxiety as a result of their symptoms. Some females with ADHD may also have a separate anxiety disorder that requires clinical attention. It is important to note that girls and women who exhibit poor attention and concentration may not necessarily have ADHD, as these symptoms could be a manifestation of an underlying anxiety disorder. It can be challenging to differentiate between anxiety and attention deficit hyperactivity disorder, ADHD, when diagnosing a young girl due to the overlapping symptoms of these conditions. It can be challenging to differentiate whether the anxiety symptoms are a result of or co-occurring with the ADHD. It is not uncommon for girls to experience anxiety related to symptoms of attention deficit hyperactivity disorder, ADHD. The persistent worrying associated with generalized anxiety disorder may impair a young woman's capacity to pay attention, concentrate, and react to everyday obligations. It is common for individuals with anxiety and ADHD to exhibit physical symptoms such as fidgeting, hair pulling, nail biting, and difficulty sitting still. It has been noted that a considerable number of women with ADHD tend to feel anxious as a result of the negative connotations that are often attached to this condition. Individuals who identify as female and experience generalized anxiety disorder tend to be preoccupied with a multitude of issues, both factual and hypothetical. Due to the intensity of this fixation, it is possible that the individual may experience difficulty concentrating on their academic or occupational responsibilities. It's possible that this could have a negative impact on students' motivation to attend class. In contrast to the diffuse and unfocused anxiety commonly seen in generalized anxiety disorder, girls and women with ADHD tend to experience anxiety that is more closely tied to their actual ADHD symptoms and the challenges these symptoms pose in their daily lives. When both disorders co-occur, which should be treated first, the anxiety or the ADHD, girls and women who experience many forms of anxiety may struggle to distinguish which condition is more acute. When ADHD symptoms are treated, clarity is often recovered. Many of these women will become calmer if their ADHD symptoms are less severe. If the anxiety was treated with a stimulant and the ADHD symptoms improved, the anxiety was most likely brought on by the untreated ADHD. The anxiety should be considered a separate illness and may need therapy in addition to ADHD if it continues or worsens following stimulant treatment for ADHD. In recent years, the non-stimulant atomoxetine, Strattera, has been used effectively to treat ADHD in individuals who also experience anxiety. Can significant childhood trauma lead to ADHD? It is very difficult to diagnose someone with ADHD only on the basis of behavior, since the symptoms of ADHD and early trauma are so similar. A girl without ADHD who has repeatedly been traumatized could become more sensitive to adult behaviors that might be risky or violent in an effort to protect herself. Due to her enhanced awareness, this girl is better able to see possible threats. She may seem to be hyperactive or not paying attention to her studies since she is more focused on the teacher's appearance. Given how similar the symptoms of both conditions are, some survivors of childhood trauma may get the incorrect diagnosis of attention deficit hyperactivity disorder, ADHD. Girls with ADHD were found to be more likely, 14.3%, than girls without ADHD, 4.5%, to have experienced abuse as children, with most cases of abuse occurring in girls with the combined subtype rather than the inattentive subtype. It seems sense that the two circumstances would intensify one another when they coexist. There isn't any proof for this theory right now. Aggressive behavior and ADHD. ADHD and oppositional defiant disorder often co-occur, particularly in men. Depending on the research, it has been shown that 20% to 24% of females with ADHD and 40% to 60% of men with ADHD suffer from oppositional defiant disorder. In contrast to the 7% of girls without ADHD who displayed oppositional behaviors, 71% of girls with mixed subtype ADHD and 47% of girls with inattentive subtype ADHD did so. Learning disorder and ADHD. There is a notable correlation between ADHD and learning disabilities, with approximately 20% to 30% of cases meeting the DSM-4 criteria for learning disorders. These criteria rely on a framework where a disparity is observed between an individual's actual academic performance and their predicted performance based on their cognitive abilities or IQ. It has been observed through certain studies that there is a significantly elevated occurrence of learning disorders, up to 70%, in individuals with ADHD. It appears that the diagnostic criteria used in the studies were not as strict as those outlined in the DSM-4 for a specific learning disorder. It is important to emphasize that academic struggles are common among students with ADHD. The student may be experiencing difficulties with their test scores, possibly due to a lack of attention to detail and challenges with retaining and comprehending the course material. It is possible for a student to experience difficulty comprehending what they read, even in the absence of a diagnosed reading disability, if they fail to maintain sufficient focus and attention. It has been observed that administering ADHD treatment to students with learning deficits can enhance their academic performance in terms of grades, although it does not have any impact on confirmed learning disabilities. According to recent research, it has been found that stimulants can be equally effective in treating children who have been diagnosed with both ADHD and learning disabilities. Chapter 5. ADHD and Eating Disorders in Females. The recent discovery of the correlation between eating disorders and ADHD could potentially have significant implications for females who have been diagnosed with ADHD. It is worth noting that the initial studies on ADHD were conducted solely on male subjects or in pre-adolescence, both of which have a low incidence of eating disorders. It's unfortunate that this connection wasn't acknowledged until we started observing adolescent girls with ADHD. Recent retrospective research indicates that adult females with ADHD have a higher prevalence of eating problems. It is a well-established fact that there exists a correlation between attention deficit hyperactivity disorder and eating disorders. Both ADHD and eating problems share common traits, such as impulsivity, emotional regulation difficulties, and low self-esteem. It appears that there may be several factors that increase the likelihood of developing eating difficulties among females with ADHD. It is common for women with ADHD to experience challenges in regulating their eating habits and managing their emotional responses to stress, which may lead to the development of binge eating disorder and other disordered eating behaviors. It is not uncommon for women with ADHD to rely on food as a means of improving their concentration or emotional state. Some individuals may experience difficulty regulating their eating habits when they become engrossed in other activities, leading to periods of forgetfulness followed by episodes of excessive snacking. It seems that women who adhere to such diets may be prone to overeating without being aware of it, which can ultimately lead to weight gain. It has been observed that women who have ADHD tend to exhibit significantly higher rates of bulimia nervosa as compared to those who do not have ADHD. This was evidenced by comparing two groups of adults, one with ADHD and the other without ADHD, where the former group had a prevalence of 12% and 11%, while the latter had a prevalence of 3% and 1%, respectively. The findings are preliminary and require further validation. However, they indicate a potential association between bulimia nervosa and attention deficit hyperactivity disorder, ADHD, in specific females. It has been found through research that adolescent females who have previously been diagnosed with attention deficit hyperactivity disorder, ADHD, are more likely to develop an eating disorder. This has been observed in several studies conducted over the years. The findings of the initial study indicate that young women with ADHD have a 3.6 times higher likelihood of developing an eating disorder, specifically anorexia or bulimia nervosa. According to the research findings, it appears that a higher percentage of girls with ADHD, 16%, developed an eating problem compared to the control group, 5%, over the 5-year follow-up period. Research has shown that girls diagnosed with ADHD may have a higher likelihood of developing bulimia and anorexia nervosa compared to those without the diagnosis. Also, the risk of developing bulimia was found to be 5.6 times higher, while the risk of developing anorexia nervosa was 2.7 times higher. It appears that females with ADHD have experienced a notable rise in the occurrence of depressive and anxious disorders, as well as disruptive behavior. Individuals with ADHD and anxiety can feel overwhelmed by their environment. Some may resort to controlling their food intake as a way to gain a sense of power and control. This behavior can be concerning and may require further exploration and therapy. It's important to note that while many individuals may experience challenges with disordered eating, only a minority of them may develop anorexia nervosa. Chapter 6. Treatment of ADHD. It has been observed that individuals, regardless of gender, who have been diagnosed with ADHD tend to respond positively to therapy that involves the use of medications that regulate the neurotransmitter systems in the brain. This approach has been found to be effective in reducing the severity of symptoms over time. It's possible that medication alone may be an effective treatment option for girls and women who have less severe forms of ADHD than it is for boys and men. It is imperative to collaborate with a certified healthcare provider who has expertise in the various stimulant and non-stimulant medications utilized to treat ADHD symptoms, if you opt for medication as a form of treatment. It is imperative to conduct a comprehensive evaluation of an individual's medical history, mental health, social and cognitive functioning before initiating medication treatment. While medication can certainly help alleviate the symptoms of ADHD, it's important to keep in mind that it may not necessarily address all of the functional challenges of ADHD. Factors such as self-esteem, time management, organization, and interpersonal relationships may require additional attention and support beyond medication. It is important to consider certain distinctions when administering medication treatment for ADHD symptoms in both boys and girls, as it can be beneficial for both genders. It may be beneficial to consider individual psychotherapy or cognitive behavioral treatment to address the symptoms of ADHD in addition to the negative thinking and poor self-esteem experienced by the girls. In regards to anxiety, depression, and social withdrawal, it is common for girls to internalize their emotions and experience distress without seeking external support. It is common for young girls to start experiencing these sensations during their middle and high school years. Untreated ADHD in females may lead to an increased likelihood of developing drug addiction and engaging in sexual acting out behaviors during the onset of puberty. It is common for women with ADHD to feel a sense of guilt and shame regarding their past disruptive behaviors during adolescence, which may persist for many years. Individual psychotherapy or cognitive behavioral therapy, CBT, may be helpful for women with ADHD to address various challenges such as depression, anxiety, low self-esteem, social rejection or isolation, and difficulties in meeting societal expectations as a wife and mother. It is recommended that women diagnosed with ADHD seek the assistance of an ADHD professional to learn how to effectively manage and organize their daily lives. Attention Deficit Hyperactivity Disorder, ADHD, in women is a multifaceted condition that requires a holistic therapeutic approach to achieve favorable results. Some strategies you can implement to support your kid with ADHD. Dealing with ADHD can be very difficult for teens and kids, but having a supportive family can greatly impact their overall well-being and success. Females diagnosed with ADHD encounter distinct obstacles that differ greatly from the difficulties experienced by their male counterparts within the same age group. In order to provide effective support for your daughter, it is important to have a thorough understanding of the challenges she may face, which can vary depending on her specific ADHD subtype diagnosis. It is common for individuals with the inattentive subtype of ADHD to experience challenges with social and emotional functioning, particularly among girls. It's possible that she could experience difficulty with the ongoing fluctuations of group interactions. It is possible to develop a heightened sensitivity to criticism from authority figures. They may have a tendency to excessively strive for acceptance and evade standing out from her educators. Adolescence can be a challenging time for females, irrespective of the presence or absence of attention deficit hyperactivity disorder, ADHD. It is not uncommon for young women with ADHD to experience a sense of overwhelm despite the support of their loved ones and early interventions. This can lead to a point of emotional exhaustion. During adolescence, girls who are hyperactive and emotionally volatile may encounter more opportunities for high stimulation, which can also bring about increased risks. It may be helpful to suggest a designated space where she can retreat to when feeling overwhelmed, allowing for a moment of relaxation and emotional regulation. It is not uncommon for a young girl who has been diagnosed with ADHD to experience emotional overwhelm. This can manifest in various ways, such as shyness and withdrawal or hyperactivity and impulsivity. In order for your daughter to regain a sense of control, it is important for her to develop the ability to recognize the specific events and people that elicit negative reactions within her. Also, it would be beneficial for her to develop an awareness of the bodily symptoms associated with stress and implement effective coping mechanisms. It would be beneficial to educate her about the significance of utilizing emotional timeouts as a means of gathering herself following an emotional disturbance, rather than as a form of punishment. It may be beneficial to assist her in establishing a calming environment where she can retreat to during challenging moments. This could potentially increase her drive to manage her emotions and ADHD. It is important to provide corrective and critical feedback in moderation. It is not uncommon for parents to inadvertently focus on their daughter's shortcomings in an attempt to help her overcome her challenges. I suggest helping your daughter recognize her areas of strength. It is common for young females with ADHD to experience feelings of low self-worth. It seems that they tend to lose motivation easily and may find it challenging to develop their skills or identify their areas of expertise. Encourage your daughter's self-awareness and self-assurance by directing her towards an area of interest or activity where she demonstrates proficiency and feels accomplished. Medication and ADHD. Research and clinical experience suggest that stimulant drugs are the most effective first-line therapy for ADHD in both males and females. There are a variety of medications, both stimulant and non-stimulant, that are currently utilized for the treatment of attention deficit hyperactivity disorder, ADHD. Research indicates that stimulant medication is the most efficacious treatment modality for individuals with ADHD, despite some dissenting opinions regarding the use of medication in this population. Additionally, certain studies conducted on children have demonstrated that medication in isolation can have a beneficial impact on treatment outcomes that is comparable to the combined use of medication and behavioral therapy. Based on current research, it appears that both methylphenidate and amphetamine treatments have demonstrated comparable levels of effectiveness for the majority of patients. It is noteworthy that recent studies have expanded their focus to include females with ADHD, and the results have indicated that their response to stimulants and non-stimulants is comparable to that of males. It is crucial to consider the diverse reactions to stimulants and non-stimulants when treating ADHD. It is recommended to initiate treatment with the minimum effective dosage and gradually increase it by 5 to 7 milligrams every 5 to 7 days until the symptoms are alleviated and the individual's functioning is normalized. Methylphenidate, commonly known as Ritalin, is a medication prescribed for individuals with attention deficit hyperactivity disorder, ADHD. It is an immediate release formulation that has a rapid onset of action and a duration of approximately 4 hours. Dexedrine, a medication that has been in use for quite some time, has been found to be equally effective as methylphenidate in addressing various symptoms associated with ADHD. However, it is worth noting that dexedrine is not as widely used as methylphenidate. The composition of Adderall comprises of generic amphetamine salts, including 3-D-amphetamine salts and 1-L-amphetamine salt. Studies have shown that the use of Adderall in children may lead to positive changes in their behavior, as perceived by parents and teachers, and also enhance their academic performance. It is important to note that the recommended maximum daily intake is 40 milligrams to ensure safety. The duration of Adderall's effects varies depending on the dosage. A 5 milligram mg dose usually lasts for 3.52 hours, while a 20 milligram mg dose typically lasts for 6.4 hours. There is a sustained release formulation of Adderall known as Adderall XR, which can provide symptom relief for up to 10 to 12 hours. Non-stimulants. Non-stimulants are sometimes prescribed to address ADHD, although this is frequently considered an off-label application or a secondary course of action following unsuccessful use of stimulants. Non-stimulants such as imipramine, tofranil, desipramine, norpramine, bupropion, Wellbutrin, venlafaxine, Effexor, clonidine, Catapress, guanfacine, Tenix, and modafinil, Provigil, can be used as treatment options. Intuniv. The extended-release formulation of Intuniv, guanfacine, has been approved for the treatment of attention deficit hyperactivity disorder, ADHD, in children and adolescents. According to clinical studies, Intuniv has been found to effectively reduce symptoms of ADHD and oppositional behavior. It is important to note that this medication is not classified as a restricted drug, and there is currently no recognized mechanism of abuse or dependency associated with its use. Sedation is a common side effect of the drug, but it typically only presents as mild to moderate and has a short duration. It appears that a small percentage, around 1%, of pediatric patients have reported experiencing fainting during the clinical trials. There were slight changes observed in the electrocardiogram, heart rate, and blood pressure. Strattera atomoxetine, Strattera, is another non-stimulant that has been approved for treating ADHD. It is important to note that atomoxetine may require at least a week to fully take effect. However, once the therapeutic blood levels are achieved, they may remain effective for up to 24 hours. It is important to note that it is advisable to administer atomoxetine for a minimum of 6 to 8 weeks before drawing any definitive conclusions regarding its effectiveness. It has been observed that atomoxetine can be efficacious for some individuals who have not responded well to stimulants. Atomoxetine is a medication that is not classified as a restricted substance and is considered to have a low risk for abuse. It is important to discuss any concerns or questions about ADHD medication with a licensed healthcare professional. They can provide guidance on the appropriate medication and dosage for an individual's specific needs. There is a discrepancy between the widespread usage of drugs for ADHD in adults and the limited approval by the FDA for such use. It is noteworthy that Strattera, atomoxetine, Adderall XR, mixed amphetamine salts, Vyvanse, lisdexamfetamine, Focalin XR, dextromethylphenidate, and Concerta, methylphenidate, have been authorized for the management of ADHD in adults since 2004. The effectiveness of medication for ADHD. It is worth noting that stimulants recommended for adults have a success rate of at least 70% when used as directed for the treatment of attention deficit hyperactivity disorder. Research investigating the influence of gender on the response to stimulants in women has not revealed any notable disparities in efficacy or safety between males and females. It has been observed that stimulants, particularly when taken in higher doses, have the potential to alleviate symptoms in a significant number of individuals within the initial week of treatment. Non-stimulant medications such as Strattera and Intuniv have also been found to be effective, although their success rate may be slightly lower. It's important to consult with a qualified healthcare professional who can evaluate your child's individual needs and determine the appropriate dosage based on their age, weight, and other factors. It's crucial to follow the prescribed dosage and monitor your child's response to the medication closely. The ideal dosage of medication is the one that effectively manages the patient's ADHD symptoms, normalizes their overall functioning, and minimizes any potential negative effects to an acceptable level. So, how can an individual achieve this balance? Tailoring treatment to individual patients is a key approach for achieving this objective. It is common practice for medical professionals to initiate treatment with the lowest effective dose of any newly prescribed medication. It is common for doctors to begin with a low dosage and gradually increase it over a few weeks while monitoring the drug's effectiveness and any potential side effects. Sometimes increasing the dosage may lead to more favorable outcomes. It is important to note that negative consequences may arise regardless of the amount taken. These effects are typically not severe and will diminish over time. It's important to note that the dosage of medication, including stimulants, is not solely based on a patient's weight or age. Instead, it's determined by the individual's specific needs and response to the medication, which is closely monitored in a clinical setting. ADHD medication and pregnancy. At present, there is a lack of well-designed research investigating the impact of stimulants on expectant mothers. However, there have been cases of pregnant women who have taken amphetamines or methylphenidate and given birth to healthy babies. There may be a correlation between exposure to methylphenidate during pregnancy and certain negative outcomes, such as preterm delivery, growth retardation, and neonatal withdrawal, as suggested by recent case studies. Based on the available data, it is the general consensus among professionals that the use of stimulants during pregnancy should only be considered if the benefits to the mother outweigh the potential risks to the developing fetus. It has been observed that certain non-stimulant medications, such as imipramine and clonidine, may provide relief to women experiencing symptoms. These medications have been deemed safe for use during pregnancy. It would be advisable for a woman with ADHD who is considering pregnancy to consult with her physician regarding the continuation of her current medication regimen. It has been reported that pregnancy may have a positive impact on ADHD symptoms for a considerable number of women. I recommend individuals to initially consider non-pharmacologic interventions such as ADHD coaching, soothing meditation, or yoga and cognitive behavioral therapy, CBT, may be helpful, although their effectiveness has not been extensively studied. Side effects of ADHD medication. It is important to note that not all individuals who take stimulants experience negative reactions. Additionally, for those who do experience such reactions, it is common for them to diminish within the initial months of treatment. Research findings indicate that a certain percentage of patients, ranging from 4 to 10%, experience adverse effects. Research findings indicate that there appears to be no discernible difference in the occurrence or intensity of negative outcomes across different types of stimulant medications. The cessation of progress over an extended period of time may have a more substantial adverse impact than the previously mentioned mild to moderate consequences. Studies indicate that there appears to be minimal variance in the development of patients' heights between the groups that received stimulants and those that did not, as time progressed. Based on recent research with follow-up periods of up to a decade, it has been observed that there are no discernible variations in the ultimate height of children who have been administered stimulant medications for varying durations. It has been observed that certain individuals who have a past medical history of seizures may experience breakthrough seizures upon consumption of high doses of stimulants or the off-label antidepressant medication, Wellbutrin, which is commonly used to treat attention deficit hyperactivity disorder, ADHD. It is important to acknowledge that adverse reactions can be uncomfortable, but it is not recommended to discontinue the use of a medication that is providing benefits. It is important to monitor for any potential adverse effects when implementing medication trials and treatment plans for ADHD with the goal of improving functioning. It would be beneficial for you to communicate any negative responses to your doctor and collaborate with them to find ways to mitigate the intensity of any potential side effects. Impact of stimulants on cardiac health, particularly in individuals with pre-existing conditions such as hypertension and arrhythmia. Studies suggest that stimulant drugs may cause a slight increase in heart rate, typically ranging from 3 to 6 beats per minute, and may also lead to a slight rise in blood pressure. While minor changes in heart rate or blood pressure may not pose a significant risk, it is advisable to closely observe patients who are prescribed stimulant medications for ADHD to detect any potential serious fluctuations. Individuals who have pre-existing medical conditions, particularly those related to the heart, should exercise great caution when contemplating the use of stimulant medication to manage their ADHD symptoms. Such conditions may include high or borderline hypertension, heart failure, arrhythmias, or a recent heart attack. There is usually a recommendation from an FDA advisory group to include a black box warning on stimulant prescriptions. This is due to the potential for adverse events and the discovery of a few unexpected deaths in individuals, both adults and children, who have been using stimulants at the standard dosage for ADHD treatment. The purpose of this disclaimer is to increase awareness among doctors and patients about potential risks and to urge them to exercise additional caution. Assessing the cardiovascular health of patients, including children, adolescents, and adults, is a crucial step before initiating treatment with stimulant medication. In order to conduct a thorough evaluation, it is important to consider two primary factors. Firstly, a comprehensive review of the patient's and family's medical history is necessary to identify any potential structural cardiac anomalies, fainting, arrhythmias, or sudden unexpected death. Secondly, a physical examination must be conducted to assess the presence of any cardiac illness. It is recommended to undergo additional evaluations, such as an echocardiogram and electrocardiogram, if there are indications of structural heart abnormalities in the results. It has been observed that the administration of standard doses of stimulants in children and adolescents with structural cardiac abnormalities has been associated with sudden and unforeseen fatalities. It is not recommended for children with structural heart defects or other significant cardiac abnormalities to use stimulants. It is crucial for medical professionals to conduct a comprehensive evaluation before prescribing stimulants, as there have been documented cases of heart attacks, strokes, and sudden deaths in adults who have taken the standard dosage. It is not recommended to administer stimulants to adult patients with ADHD who have underlying cardiac conditions, such as coronary artery disease or irregular heart rhythms. It is recommended that individuals who experience cardiac symptoms, such as chest pain or syncope, while taking stimulants seek immediate referral for a cardiac evaluation. Chapter 7. The effects of yoga and meditation on ADHD. While it may not be accurate to classify mindfulness techniques, such as yoga and meditation, as treatments for attention deficit hyperactivity disorder, ADHD, they could potentially aid in enhancing focus and concentration, as well as reducing the anxiety that frequently accompanies the condition. Yoga. Yoga can be a beneficial practice that enables you to gain a sense of control over your physical and mental state through a blend of stretching, movement, postures, and intentional breathing and relaxation techniques. It is recommended to practice yoga in a serene environment, although it is feasible to engage in it in any setting. Research has demonstrated that incorporating yoga or similar practices into alternative treatments can have beneficial outcomes in the therapeutic treatment of ADHD in children. Meditation. Throughout history, individuals have utilized meditation as a technique to enhance their capacity to focus on a singular task, frequently their breath, at any given moment. Developing the ability to remain present and composed during stressful situations are two advantages of practicing meditation. Research has shown that engaging in meditation can have positive effects on both physical and emotional well-being. Specifically, it has been associated with reduced blood pressure and heart rates, as well as an enhanced mood. One can employ short meditation techniques to enhance present moment awareness or to alleviate immediate stress. Mindfulness meditation and the three-breath method are two practices that can be helpful for improving one's mental well-being. The utilization of the three-breath technique can be beneficial in terms of redirecting one's attention and promoting a state of relaxation. The technique of taking 3 deep breaths is a simple and uncomplicated method. As you engage in this activity, you may experience a sense of tranquility that envelopes you. In addition to the three-breath technique, incorporating mindfulness meditation into your routine can assist in enhancing your focus on the present moment while engaging in any task. I suggest experimenting with it for a period to determine if it is suitable for you. It is possible to obtain books and cassettes regarding meditation techniques for various libraries and stores. You may consider seeking the assistance of a nearby therapist or mentor who integrates this approach into their practice as an alternative choice. Various methods such as elimination diets, vitamin intake, working memory training, and biofeedback are utilized as brain exercises and other forms of brain training. Elimination diet could be beneficial if your child is exhibiting symptoms of attention deficit hyperactivity disorder, ADHD. It is important to consider the potential benefits of incorporating zinc supplements into one's diet. Research suggests that there may be a correlation between low levels of zinc and attention deficit hyperactivity disorder, ADHD, in children. It has been observed that the symptoms of hyperactivity and impulsiveness in children with ADHD have shown improvement when they were given zinc supplements along with conventional therapy. It is interesting to note that a study conducted some years ago also found a correlation between zinc levels and the perception of inattention in children by both teachers and parents. It is possible that the consumption of fish oil may have a positive impact on mitigating the symptoms associated with ADHD. It is possible to obtain omega-3 fatty acids from fish oil. Research suggests that the incorporation of fish oil into the diet of children between the ages of 8 and 12 who have ADHD may have a positive impact on their cognitive functioning. Neurofeedback. The objective of neurofeedback is to assist the patient in learning how to modify their brain wave pattern to increase their levels of arousal. The user is notified through a signal once their brain waves have achieved the desired frequency. Through training, the patient has the potential to develop the ability to self-stimulate their own arousal. It appears that there is some promising research regarding the potential benefits of neurofeedback for managing symptoms of ADHD. One effective strategy for enhancing your cognitive abilities is to focus on improving your working memory. This can be achieved through various techniques, such as practicing mindfulness, engaging in regular physical exercise, and challenging your brain with new and stimulating activities. By consistently working to strengthen your working memory, you can enhance your overall cognitive functioning and improve your ability to process and retain information. Working memory, which refers to the ability to temporarily retain information, plays a vital role in one's ability to concentrate and acquire new information. The capacity to maintain information is a vital aspect of performing effectively on assessments and comparable tasks. Individuals of both younger and older age groups who have been diagnosed with ADHD have shown challenges in regards to their working memory and other executive functions. The cerebellum is responsible for coordinating voluntary movements, such as posture, balance, coordination, and speech. Exercises that focus on enhancing the functioning of the cerebellum are designed to address deficits in coordination and delayed information processing, which are commonly associated with attention deficit hyperactivity disorder, ADHD. Chapter 8. Learning Difficulties and ADHD. Approximately 50% of children diagnosed with ADHD also experience a co-occurring learning disability. It's interesting to note that while ADHD is not classified as a learning disorder, individuals with ADHD frequently encounter learning challenges that are now being recognized in academic environments. Although attention issues may not necessarily indicate a learning disability, they can still have a considerable influence on a child's academic performance. It is common for children diagnosed with ADHD to experience difficulty in retaining lengthy lists of information. These children may struggle with retaining information that lacks contextual relevance or practical application, potentially due to lapses in attention during the presentation of said information. Due to their susceptibility to distractibility, it is possible that these children may require additional time to process information, both in the classroom and on standardized tests. Children who experience difficulty with maintaining focus, exhibit restlessness, and struggle with sitting still may encounter challenges in their academic performance. It is common for children with ADHD to experience challenges in various subject areas, which may be linked to difficulties with planning, organization, retention of information, and social interaction. Moreover, studies suggest that youngsters diagnosed with ADHD exhibit poorer performance on standardized assessments of scholastic accomplishment compared to their counterparts. It is common for children diagnosed with ADHD to experience additional academic challenges. Research indicates that a significant percentage, ranging from 25 to 30%, of children diagnosed with ADHD also experience a co-occurring learning disability. It has been observed that there is a higher prevalence of children with ADHD who also exhibit learning disabilities. Difficulties with coordination may affect the ability to perform both gross and fine motor skills. The symptom complex of ADHD encompasses difficulties with attention, motor skills, and visual spatial perception. It is not uncommon for children with ADHD to experience challenges in nonverbal learning as well. As children progress through their academic journey, they may encounter challenges in various subjects such as mathematics, science, language arts, and reading comprehension. It is advisable to conduct a comprehensive evaluation of a child's abilities to ascertain if the child is experiencing learning difficulties related to ADHD or a learning disorder that coexists with an ADHD diagnosis. ADHD challenges with classroom activities. There are certain components of the typical school curriculum that may present particular difficulties for children who have been diagnosed with ADHD. It is not uncommon for children diagnosed with ADHD to experience difficulties in maintaining attentive listening and recalling factual information accurately. They may find it difficult to excel in courses that prioritize public speaking and the ability to retain information. It is common for children with ADHD to face difficulties when it comes to acquiring a foreign language. They may experience difficulty with maintaining a consistent routine for acquiring new vocabulary terms. It's possible that they may find math challenging due to the requirement of memorization. To achieve success in this course, it is important to have a methodical and well-organized approach to work. It is common for students with ADHD to present work that may appear disorganized or messy. They may have difficulty with task sequencing and organizing their thoughts in written form. Moreover, it is possible that the individual's attentional focus may be compromised, thereby hindering their ability to detect a critical mathematical symbol, e.g., plus or minus. This may result in errors that are not necessarily indicative of their mathematical proficiency. It has been observed that individuals with ADHD tend to perform optimally in learning environments that incorporate hands-on activities, break down the material into smaller, more manageable segments, and encourage active participation from the students. It is possible that a child with ADHD may not thrive in a learning environment that involves lengthy lectures or dimly lit auditoriums for slide presentations. ADHD and reading difficulties. ADHD may not be the direct cause of reading difficulties or dyslexia, but it can certainly impede an individual's reading ability. Children diagnosed with ADHD may experience difficulty in maintaining focus while reading lengthy texts, leading to distractions. It is common for children with ADHD to experience difficulties in academic settings that require prolonged periods of sitting still, reading lengthy passages, and answering multiple-choice questions. As a result, their performance on standardized reading exams may not be as strong as their peers. It is plausible that the issues they are experiencing do not stem from difficulties in decoding or comprehension. Their difficulty with reading may be a manifestation of an underlying challenge with sustaining focus and attending to specifics. It's important to note that ADHD and dyslexia are distinct conditions. Children with ADHD frequently encounter difficulties in the academic setting. Also, some children with ADHD may thrive in structured and organized environments, such as those found in special education classes. It would be beneficial to inform the instructors if there is a particular approach that has proven to be effective in supporting your child's learning. It is important to ensure that the educational institution is informed about any external professionals who are providing assistance to your child. Additionally, it is beneficial to encourage transparent communication channels between these professionals and the school. It is crucial for parents to maintain open communication with teachers and administrators. As a psychologist, it is recommended that parents of young children with only one teacher maintain open communication through phone or email. When all individuals involved in a child's education are recognized and appreciated for their contributions, the educational institution is more likely to make adjustments that align with the family's needs and priorities. How to effectively support kids with ADHD in school. It has been observed that students diagnosed with ADHD tend to thrive in a school environment that is characterized by both structure and emotional support. It is important for your child's teacher to acknowledge and value the necessity for modifications and individualized programming, as children with ADHD have unique needs. If your child's behavior is interfering with their education, it may be helpful to discuss the matter with their teacher. The teacher can provide guidance on implementing a behavior management plan. Collaboration between the parent and the school's administration is necessary to identify the most suitable instructors for your child. Determining the appropriate educational setting for your child can be a complex decision. It may be helpful to consider your child's unique strengths, challenges, and learning style. Additionally, consulting with educators, professionals, and specialists can provide valuable insight and guidance in making this decision. It is possible for children with ADHD, particularly those with mild to moderate symptoms, to excel in the classroom with the assistance of medication alone. It is important to note that individuals have varying needs when it comes to adjusting to their environment. Some may require less passive support, while others may benefit from a more tailored educational setting. It is important to be mindful of your child's education and their educators during this critical period. It is recommended that parents take the time to review their child's report card and attend parent-teacher conferences, as these actions can provide valuable insights into their child's academic progress and overall well-being. Chapter 9. How to talk to your kid about their condition, ADHD. It can be challenging to discuss a child's ADHD diagnosis with them. It's important to approach the topic with sensitivity and empathy. Consider having an open and honest conversation with your child, allowing them to express their thoughts and feelings. It may also be helpful to provide them with age-appropriate information about ADHD and how it may impact their daily life. When a child is diagnosed with ADHD, it is important to consider the best approach for discussing the diagnosis with them. The child's age, temperament, and the parent's parenting style are all important factors to consider when deciding how to communicate with them. It is important to be transparent with your child about their condition and not keep it hidden from them. It can be helpful for children with ADHD to have a clear understanding of what they can and cannot control, as well as a clear understanding of what is happening to them and why others may react to their behavior in certain ways. It is advisable to communicate to children in a developmentally appropriate manner about how their behavior may be influenced by a medical condition. This is because young children are capable of participating in significant discussions, but may not possess the linguistic abilities required to effectively communicate. During childhood, individuals gradually realize that not everything is within their control. However, as they grow older, it becomes imperative for them to shift their attention towards the aspects that they can modify. It is important for adolescents with ADHD to understand the ways in which the disorder may impact their academic and social growth, as well as the strategies they can employ to enhance their personal development. It is important for adolescents to develop self-advocacy skills by directly communicating with their instructors about their academic challenges and requesting personalized assistance. During adolescence, individuals tend to engage in a significant amount of exploratory and boundary-pushing behavior. Adolescents hold the power to determine their own course of action, despite the norms established by their parents and society. It is important to guide adolescents and young adults towards developing decision-making skills and taking accountability for their choices during every interaction. It is imperative to have a conversation with your adolescent regarding their medication usage. It is important to note that medication with stimulant properties is classified as a controlled substance. It is recommended that parents of high school seniors engage in meaningful conversations with their children regarding their health prior to their departure for college. It's understandable to feel unsure about sharing your child's ADHD diagnosis with others. It's important to consider your own comfort level and the potential impact on your child before making a decision. It may be helpful to discuss your concerns with a trusted healthcare professional or therapist to gain further insight and guidance. It is recommended that individuals who are in regular contact with your child, such as teachers, babysitters, and parents of classmates, are informed about your child's ADHD diagnosis. This can help them provide appropriate support and intervention if your child experiences any behavioral difficulties. ADHD and the ability to socialize. Children diagnosed with ADHD may experience difficulties in establishing significant social relationships. Children with ADHD who are talkative and have multiple interests may initially find it effortless to form friendships. It is common for children diagnosed with ADHD to experience difficulty in establishing and sustaining friendships. It is common for younger children to vocalize their dissatisfaction with playmates who have ADHD due to their tendency towards more aggressive behavior. It is common for children with ADHD to rely on physical touch as a means of communication, which can manifest as rough touch or excessive hugging. It is possible that your child's desire for physical touch could elicit discomfort in their peers. It is important for children with ADHD to learn how to adapt to societal norms in order to avoid potential negative consequences in their future. It is common for children diagnosed with ADHD to experience challenges when it comes to participating in group activities. It is also common for children diagnosed with ADHD to experience challenges in developing social skills that may come naturally to their peers. It seems that they may struggle with conversational skills, such as taking turns speaking and staying on topic. They may also have a tendency to interrupt others. It appears that children with ADHD may experience difficulties with attentive listening. It's common for individuals with communication difficulties to experience challenges in maintaining friendships, which can lead to feelings of impatience and frustration among their peers. Chapter 10. How ADHD manifests across the various life stages. Parenting young children can be a challenging experience, even in the most favorable circumstances. It is common for parents to understand the concept of the terrible twos when discussing their child's third year of life. Imagine living with a child who, at the age of 1, has stopped taking naps, has an altered sleep schedule compared to peers, and exhibits hyperactive behavior that may lead to dangerous situations. It has been observed that young children diagnosed with ADHD may be more vulnerable to experiencing physical abuse, particularly in situations where families are facing significant stressors. It can be challenging to differentiate between typical developmental patterns and ADHD behaviors in children until they reach the age of 4. Despite some parents' claims of identifying potential issues from the very beginning, and some experts' assertions of diagnosing ADHD as early as 2 years old, it remains a complex process. It is not a coincidence that the current professional demands coincide with the developmental stage when a child may first encounter the need to practice self-regulation in a preschool setting. The manifestation of inattentive ADHD symptoms is typically not evident until a child is faced with the academic requirements of elementary school. Typical display and manifestations of ADHD in elementary school. It is common for children diagnosed with ADHD to face challenges in their academic performance, particularly during the second grade. This is often due to the increased academic demands placed on them by their teachers, including homework assignments. They may struggle with task management and organization, leading to missed deadlines and forgetfulness. It seems that their attention is directed towards avoiding a particular subject. Research indicates that a significant proportion of children with ADHD experience academic difficulties, with more than half failing at least one grade. While it is true that some children with ADHD may exhibit exceptional intelligence, others may not perform as well. Research indicates that, on average, students with ADHD tend to score lower on standardized tests of reading, writing, and arithmetic when compared to their non-ADHD peers. It is possible that co-occurring learning disorders may be contributing to the issue. It is common for them to experience a range of emotions and behaviors when navigating life and society. The expectations and norms of social interactions can often lead to feelings of pressure, anxiety, and stress. It is important to recognize and address these emotions in a healthy manner in order to maintain positive relationships and a fulfilling social life. As children grow older, they begin to assert their independence and may challenge their parents' choices regarding playdate companions. Children diagnosed with ADHD may struggle with social interactions, such as respecting personal boundaries and engaging in overly aggressive behavior. As a result, they may experience social exclusion when groups form. It has been observed that children with ADHD tend to experience peer difficulties at a rate that is almost 3 times higher than what is considered typical. Research suggests that children with ADHD are more likely to experience rejection from their peers compared to those with other mental or behavioral disorders, such as depression, anxiety, autism, or conduct disorder. Research has also shown that experiencing rejection from peers during elementary school is a significant predictor of various negative outcomes, including criminal behavior, failure to complete high school, and persistent mental health challenges. This has been consistently observed across multiple large-scale studies conducted in various school districts. Social exclusion had a more significant influence on the growth of a child with ADHD than any medical condition. The experience of social rejection can have significant consequences, similar to those of being expelled from school. These kids may not only experience emotional pain, but also misses out on opportunities for personal and intellectual growth. It is fortunate that research indicates that the impact of social exclusion can be reduced to a certain degree by having at least one intimate companion. Children diagnosed with ADHD may require more time to establish friendships, may encounter more challenges in building new relationships, and may find it harder to repair damaged friendships. It is important to recognize the significant impact that ADHD can have on an individual's social life. Therefore, it is crucial to prioritize strategies that can help children with ADHD avoid social exclusion and stigma during therapy. The stress of parenting kids with ADHD. As children with ADHD enter elementary school and encounter difficulties with their teachers and peers, their parents, particularly women who tend to provide the majority of care, experience a significant increase in stress. Mothers of children with ADHD often experience decreased levels of self-esteem, feelings of sadness, self-blame, and social isolation. This is due to the fact that they are often subjected to criticism from teachers and other parents, which can be quite distressing. According to a recent study, parents of children with ADHD tend to experience higher levels of stress compared to parents of children with autism spectrum disorders. Research suggests that the rates of divorce and separation tend to be at least twice as high in such circumstances compared to the national average. The challenges faced by parents of children with inattentive ADHD can be quite taxing, particularly when it comes to nightly battles over schoolwork. These struggles can take a significant toll on both the parent and child, causing a great deal of stress and frustration. It is common for parents of children with ADHD to experience a sense of learned helplessness after prolonged periods of unsuccessful attempts to communicate and manage their child's behavior. This may lead to a withdrawal from parenting responsibilities, particularly during the adolescent years, which is a crucial time for setting boundaries and providing guidance. A brief introduction to ADHD in young adults. Some common signs of ADHD in young adults may include difficulty with organization, forgetfulness, impulsivity, and difficulty with sustained attention. It's important to seek a professional evaluation if you have concerns about ADHD. It is common for adolescents diagnosed with ADHD to exhibit less hyperactivity compared to their childhood years, despite still meeting the DSM criteria for the disorder. It seems that despite a decrease in physical activity, individuals with ADHD in adulthood often experience persistent racing thoughts. It's important to keep in mind that ADHD encompasses more than just hyperactivity. The root mainly lies in struggles with maintaining focus, managing distractions, and regulating one's own behavior and emotions. Research suggests that adolescents with ADHD are at a higher risk of experiencing academic and disciplinary difficulties compared to their peers without the disorder. In fact, studies indicate that at least 3 times as many adolescents with ADHD may face challenges such as failing grades, suspensions, or expulsions before reaching the age of 18. It is common for adolescents to exhibit a higher propensity for engaging in risky behaviors, challenging authority figures, and expressing a desire for greater autonomy from their parents. During adolescence, the brain undergoes significant changes that drive teenagers to seek independence from their parents. As a result, they may be more inclined to test limits and challenge authority figures. The natural inclination towards this behavior is frequently intensified in individuals diagnosed with ADHD, particularly in children. Individuals with ADHD tend to exhibit sensation-seeking and impulsive behavior, which may lead to involvement in negative activities such as substance misuse and smoking. It is important to note that addictions, such as excessive internet usage and gambling, can have significant negative impacts on adolescents, particularly those who exhibit symptoms of hyperactive or inattentive ADHD. It is not uncommon for adolescents with ADHD to engage in sexual behavior at an earlier age than their peers. ADHD is being acknowledged as a significant public health issue due to its association with higher rates of adolescent pregnancy, sexually transmitted diseases, vehicular accidents, other fatal and non-fatal injuries, delinquency, and hospitalizations. Studies suggest that young women with ADHD may face an increased risk of experiencing physical abuse from their partners as they transition into adulthood, compared to those without the disorder. It's important to note that depression, mania, and suicidal thoughts or actions are potential consequences that one may experience. It is worth noting that teenagers diagnosed with ADHD may have a higher likelihood of experiencing depression, which is a common occurrence during adolescence. It is important to note that young individuals with this condition are at risk of experiencing demoralization due to their tendency to focus on their perceived failures and social rejections. Adolescent girls diagnosed with ADHD are more prone to experiencing depression and have a higher likelihood of developing eating disorders, specifically bulimia, which involves recurrent episodes of overeating followed by compensatory behaviors. It has been observed that adolescents diagnosed with ADHD, regardless of gender, tend to exhibit patterns of disordered eating and sleeping. It is noteworthy that young females with ADHD have a higher likelihood of engaging in self-harm behaviors, such as cutting, as well as attempting suicide. The impulsiveness exhibited by them can be particularly hazardous during this developmental stage. Individuals diagnosed with ADHD are found to have a significantly higher rate of automobile accidents during their initial years of driving, approximately 4 times greater than those without the disorder. Additionally, their behavior on the road may be putting others at risk, as they are more likely to be involved in accidents that result in harm to others. Research has demonstrated that the presence of inattention and impulsivity can have negative consequences in simulated driving scenarios. These 2 psychological factors may result in risky behaviors, such as attempting to cross intersections on yellow lights. It may be beneficial for parents of adolescents with ADHD to delay their visit to the DMV and prioritize providing them with sufficient behind-the-wheel practice. It is important to ensure that the adolescent is receiving appropriate treatment, such as medication or behavioral therapy, prior to turning 16. Chapter 11. A brief introduction to ADHD in adulthood. In the past, it was commonly believed that symptoms of ADHD would naturally diminish during adolescence. It is true that hyperactive actions such as fidgeting and running around tend to diminish during adolescence. However, recent findings indicate that other severe indications, such as excessive mental agitation, severe lack of concentration, impulsiveness, and difficulties with planning and self-management associated with executive functions, endure throughout adulthood. Research indicates that a significant proportion of individuals diagnosed with ADHD during childhood continue to exhibit symptoms that meet diagnostic criteria into adulthood. It's common for individuals who no longer meet the complete criteria for ADHD to experience significant impact from anxiety, depression, drug abuse, antisocial behavior, and addictive behaviors such as gambling or internet use. This may also contribute to struggles in intimate relationships. Research has revealed that individuals who have been diagnosed with attention deficit hyperactivity disorder may face challenges in securing employment. They are 14% less likely to be employed compared to their peers without the condition. Attention deficit hyperactivity disorder is a valid condition that can have significant consequences for adults if not properly addressed. ADHD and self-esteem. Maintaining a balanced level of self-esteem is crucial for your overall well-being. Low self-confidence can significantly contribute to experiencing emotions of hopelessness and sadness. Individuals diagnosed with ADHD often exhibit lower levels of self-confidence. Research indicates that they may experience a decline in self-esteem as they encounter negative experiences throughout their lives, although some may maintain a positive self-perspective. Individuals with ADHD often face exacerbated challenges due to their low sense of self-worth. Does ADHD have positive effects on individuals? According to research, it appears that the genes linked to attention deficit hyperactivity disorder can be traced back to the era of hunter-gatherer societies. During that time, it would have been advantageous for a certain percentage of the population to exhibit more risk-taking and impulsivity. Individuals with ADHD may possess heightened alertness in certain scenarios, potentially making them adept at identifying both prey and predators. The inclination of individuals with ADHD to explore novel experiences has been found to be beneficial during periods of significant disruption. It is fascinating to consider that during the time when a land bridge connected Asia and North America across the Bering Strait, individuals with the DRD4-7 R allele were more inclined to embark on the challenging journey. It is worth noting that the DRD4-7 R allele, which is associated with a tendency towards seeking novelty, has been found in higher frequencies among human remains discovered along the western coasts of North and South America. It is interesting to consider the potential impact of the DRD4-7 R allele and other ADHD-related gene patterns on our species. According to Darwin's theory of natural selection, if these genetic traits were fundamentally detrimental, they would likely have been eliminated over time. It is not uncommon for individuals who have achieved great success in various fields such as business, art, entertainment, and academics to have a history of attention deficit hyperactivity disorder, ADHD, during their childhood. According to the gift hypothesis of ADHD, individuals with the condition may experience potential benefits due to their tendency to not immediately suppress their creative impulses, unlike those without the disorder. It is interesting to note that in biographies, Albert Einstein is often portrayed as a disorganized daydreamer who exhibited delayed speech as a child and made the decision to discontinue his education after completing his primary schooling. This portrayal has led to him becoming a symbol for the argument that unconventional thinking and non-traditional educational paths can lead to great success. It is often noted by biographers that Wolfgang Amadeus Mozart had a tendency to create music while engaging in physical activities such as walking, horseback riding, or playing billiards. It is not uncommon for executives at Fortune 500 companies to attribute their ADHD as a contributing factor to their creativity and willingness to take risks. What are some environments in which individuals with ADHD tend to excel? While there is no such thing as a magic school or job, it is important to note that adolescents with ADHD can greatly benefit from having breaks between sitting and standing for more than an hour. Similarly, individuals in the workforce can benefit from seeking out employment that offers a balance of structure and novelty to keep them engaged and excited. Some experts suggest that military service can help young individuals with ADHD to establish discipline, while others recommend high-intensity occupations such as sales, policing, or entertainment. Individuals with attention deficit hyperactivity disorder, ADHD, who struggle with authority or collaboration may often choose to pursue entrepreneurship as a career path. It is important to note that academic struggles, bullying, frequent accidents, and potential issues with drug misuse, self-harm, or crime during adolescence are not necessarily experienced by all individuals with ADHD. Attention deficit hyperactivity disorder, ADHD, can persist into adulthood and later years, causing significant impairment in daily functioning. It is important to seek professional evaluation and treatment to manage symptoms and improve quality of life. It is important to understand that a significant proportion of individuals diagnosed with ADHD may not exhibit overt symptoms in adulthood. However, it is important to acknowledge that many of these individuals may still experience the repercussions of their condition, such as anxiety, depression, and the negative impact on their academic and professional pursuits.